Hi, I'm Brittany Montez, and this is the Orlando Health News Review for February 27th, coming at you from the Orlando Health Production Studio. In today's episode, we're going to take a look at the Studio Lucerne and talk to Keena Lewis, Director of Public Affairs and Media Relations. Hey, Keena.
Hi, Brittany, come on in. I want to show you Studio Lucerne. It's very cool. We moved over here in October from formerly over on Underwood. There are 5 sets and a conference room that are available for any Orlando Health Department or team member. Some of the sets that we have an office set, which you can use, of course, if you need to look like you're in an office. Across the hallway, here's a set you're probably pretty familiar with, the kitchen set. You've seen it on News Review several times for different segments. We also have an exam set, a medical exam room that we use a lot for Facebook Live and other activities. And then we have a large open set that we use for press conferences. You could record a presentation here. We can change the backdrop to whatever you need. And then the really cool thing is a green screen. In a green screen, you can be on any set you want. So if you're interested in shooting still photography or videography in the studio, just send an appointment to our Studio Lucerne and it will get confirmed or rebooked as soon as possible.
Did you know that Orlando Health Arnold Palmer Hospital for Children is one of 170 Children's Miracle Network hospitals? Every year, Children's Miracle Network hospitals identify a champion in each of their local communities. These ambassadors spend their year advocating for the charitable need of children's hospitals across North America. Last week, Patrick and William Jacobson were selected to serve as the 2019 patient champions for Orlando Health Arnold Palmer Hospital.
I feel great. And what do you feel? I feel that this is a right opportunity for Children's Miracle Network to connect with the community and the media. I'm just so honored to be here today as the theme and Arnold and Winnie Palmer champions for 2019.
When we come here, we feel like this is our second home in so many ways, and just to be able to go out and share with the rest of the Central Florida community what a wonderful place this is. It's truly an honor. It really is.
Now for the latest on ELLiE. Next week marks a major milestone for the project. Here to tell us all about it is Sherry Buxton, Assistant Vice President, ELLiE Program Executive, who is leading the implementation team.
We had over 400 applicants for 2 job descriptions that were posted. We're filling about 133 slots initially. They start on March 4th. And we had to fill about 85% of that number in order to schedule them for EPIC training. So as of right now, we're a little bit greater than 85%. We're very happy about that, and we will continue to fill until we get the number that we need.
And recently, Orlando Health OMC celebrated a new process called VIDA, or Very Important Discharge Appointment, that is helping us to get patients out of the emergency department and to their admitted room safer and faster, as well as to decrease our length of stay for patients who are ready to be discharged. The team celebrated with their rendition of Livin' La Vida Loca, written by the team themselves.
So VIDA is a project that was started a couple months ago, and the term is an abbreviation for a very important discharge appointment, with the goal being that patients will be identified the day before as to who's going to be leaving the next morning. So they have a rough idea about when they'll be heading out of the hospital, so their families can prepare, they can prepare, make sure everything's set up so they're ready to leave.
The VIDA project has gone really well so far, and that's because of the engagement from every team member and every department throughout the hospital. Whether it's inpatient nursing units or allied health departments, our physician partners, everyone has truly come together to help this project be successful.
From a care management perspective, there is a greater need for decreasing our length of stay. That's essentially what we tend to focus on. And so having earlier discharges really helps with that. If we can get a patient discharged an hour before they would normally have gone, will definitely help with our length of stay and throughput.
And for this week's Hot Fact, did you know that since April 2016, 415 patients have been treated by proton therapy at Orlando Health UF Health Cancer Center? This proton beam therapy was made possible through the support of fundraising like the Team Member Giving campaign. Well, that's it for today's edition of the Orlando Health News Review. Thank you for making Orlando Health the best hospital possible. See you next week.